Good evening, everyone, and welcome to today's webinar, Reflux, GERD, Heartburn, and How to Assess and Treat the Patient, Not Just the Symptoms. My name is Max Langhurst, and I'm a functional medicine consultant at QO Labs. I will be your moderator for the presentation. QO Labs is a healthcare professional supplement company with a mission of providing products containing clinically backed ingredients and dosages shown to be effective in humans. I have everyone on mute to avoid background noise. However, during the webinar, you'll have the opportunity to submit questions to today's presenter, Dr. Jason Piken, by typing your questions into the Q&A section of the control panel, located at the bottom of your screen. You may send in your questions at any time, and we will address them at the end of today's presentation. I would now like to introduce Dr. Jason Piken. Dr. Jason Piken is a chiropractor, a nutritionist, a practitioner of Applied Kinesiology, and a published author of Better, 11 Simple Habits to Improve Your Life. He has been in practice for over 20 years in Midtown Manhattan, and his focus is on treating the whole patient physically and emotionally. And without further ado, Dr. Jason Piken.
I wanted to start talking to everybody out there about is why I was personally drawn into learning about digestion. And you know what? Before I even get to that, I like to just thank everybody for actually spending and investing some of your hard-earned time in learning, because I find so many people that just want to do the same thing over and over and over again. And it's people like you that are on the line and the people that will watch this in the future that are really going to make a difference in patients' lives. And so thanks for showing up. And so I'll give you your applause. But why I was personally drawn into learning about digestion is because at 26 years old, I developed acid reflux. And I was a chiropractor. I just was like kind of brand new in practice. And I thought it was pretty embarrassing to be this health practitioner. I was supposed to be the epitome of health. And I would like literally have this, liquid come up into my mouth at the end of certain days. And it was just horrible. So it led me into learning how to fix myself. Soon after that, I met my wife and I found out after 3 months of knowing her that she had a 10-year-old irritable bowel problem. So I was very into digestion because of what was going on in my life. And to give you a background on how my acid reflux developed is going to also give you some background on what we're going to be talking about today. I know my acid reflux developed right from birth. Right from birth, I was not breastfed. I was given formula. I was born a child in 1971. And of course, formula was best back then. And so I was never inoculated with the good, proper bacteria from breastfeeding. I was on multiple antibiotics for the first few years of my life for chronic ear infections. And later on in life, later on meaning after 5 years old, I ate pretty poorly. I used to have McDonald's hamburger eating contests with my friends. There was not really much of an ounce of good food going into me. And then later teenage years on antibiotics again for a few years for acne. So the first 18 years of my life were filled with a lot of damaging substances to my digestive tract and not a lot of good. So by the time 26 years rolls around, the manifestation of all that injury shows up. And the reason why I said that story is because this is really, as practitioners, what we're seeing every day. Not somebody that comes to your office and says, well, yeah, I've had reflux for the past 3 weeks. And you realize that when you have to describe to them that they've actually had this their whole life is a common story. So if you're watching this webinar, you're probably just like me. You've probably been dealing with these patients and you just want to learn how to make them better. What the takeaways I want every single person on this line to get is that I want you to think about these patients differently, not as an acid reflux patient, but to take a look at their whole physical, chemical, and emotional self. I'd hope that you're going to learn how to treat them as a person, not as a disease. What we're also going to be talking about is the 3 major factors involved with every patient that has reflux. That's the next slide. And you're going to walk away learning exactly what to do starting tomorrow to help that next person that has reflux. Notice I mentioned that person that has reflux, not the acid reflux patient, but the person that has reflux tomorrow in your office. So let's go to the first slide, which is the first takeaway. The real cause of reflux: physical, if you look at the slide on the left, the picture on the left; chemical, the center; and emotional stress. These three things, physical, chemical, and emotional stressors, are what I deal with. And docs out there, no matter what practice you're in, this is what you deal with every single day. And I know this. A lot of us don't have the time to deal with all of these aspects, so we concentrate on one. There may be mental health professionals out there dealing with the emotional stress. There may be chiropractors or physical therapists dealing with the physical side of things, or acupuncturists. And there may be nutritionists listening to the nutritional side of things. As a practitioner, I took on the role of assessing all of these things with each and every patient because it made the most sense to me. That's what being an applied kinesiologist is. What I want everybody on here that may be a specialist and doesn't focus on all these things to do after we're done here is to maybe think that there may be other links, especially if the treatment that you do, that's your 80%er, that you do this one acupuncture movement, you give this group of supplements, and 80% of the time when a person with acid reflux gets better, when they don't, maybe you can start to think of these other factors if you don't already. So we're going to tackle first the number one, the emotional stress. Probably the most challenging of them all. So what I'm going to do is talk about, I'm not just going to read line by line, but what we're going to talk about is how these emotional stresses affect the digestive system and can cause acid reflux. All these 6 bullet points were all taken from this one article that I have listed in the back on the bottom. At the end of the lecture, there's going to be a list of all the other articles that I reference everything from. So you can take it down there. The first one, alterations in GI motility. If you don't know already, neurotransmitters, or the chemicals that run your brain, also have an effect on the peristaltic motions of the esophagus and the stomach. Just GABA, which is supposed to be a relaxing chemical for the body, and acetylcholine, which is another chemical from the brain, can actually stimulate or, lack thereof, subdue the peristaltic motions. So if you're dealing with stress, if you're dealing with abnormal neurotransmitter function, it's going to affect the movements of the stomach and the ability to get that food down. There's increasing visceral perception for somebody that's dealing with emotional stress, which basically means even if there is a small problem, they can blow it up. They can make it seem like it's a lot bigger than it really is. And so you might actually have somebody that's quote unquote getting a lot better, that you've done all the right things from, but because you haven't, or they haven't addressed their stress response, they may be complaining a lot more because they're wanting more help. It's not necessarily the reflux that they need help with, but the help with handling stress. And you've got to recognize that as a health practitioner. The changes in gastrointestinal secretion and the permeability really have to do with the sympathetic and parasympathetic nervous systems. Most of us know out there that there are these two halves of our nervous system. And most of our patients that come to us, if you're like me and you're in New York City or you're in a major city out there, are going to be sympathetic dominant patients, meaning that all day long they're driving their nervous system really hard. They're working really hard. They're working out maybe too hard. They're looking at their phones constantly, and they're thinking thoughts of stress all throughout the day, which basically stimulates the sympathetic nervous system, which is fight, flight, or move and get things done. But they're not spending enough time in the parasympathetic system. The parasympathetics are about resting, healing, digesting, your immune system. It's been shown that ever since the invention of the radio, well, heck, electricity, that we've been losing sleep and spending more time awake and stimulated just because we actually have a light to see things by. Or with the radio, that we had entertainment. With the TV, we actually stay up even later. And now with internet surrounding us constantly, we have basically the most powerful computer in our hands at all times. People are just not taking the time to shut down and relax. And that's how you can improve your digestion, by teaching your patients to shut down and relax. Of course, increased stress also suppresses the immune function, so you're not able to heal if you do have an irritation in your stomach. And the microbiome. The microbiome is something I'd love to spend, 3-4 hours on just on its own. But stressful thoughts not only affect our physiology, but they can actually upregulate or change the microbiota themselves. Whatever you feed your body is also feeding the bugs inside your body. And when I talk about feeding the body, the next slide is about chemistry and food. But what I also talk about is whatever you put in your brain creates certain kinases and chemicals that will have an influencing effect on those bugs. So if there's something like an H. pylori infection, that could be one of the causes of acid reflux, that can be affected by stress. Okay, so emotional stress, is the summary, is affect our digestive system negatively. And if you're not addressing those with your patients, what we're going to do is, as we go through this, we're going to teach you how, or at least some of the basics. But hopefully you take stress into effect. All right, so chemical stress. Here's the next thing that most of us are used to. So the most common thing that I didn't put down here is the most common treatment for acid reflux, which is using the medications, which is on the bottom. The medications are typically proton pump inhibitors, acid reducers, yet even though it does help with the feeling of acid reflux and the symptoms, at least 30–40% of the time, there are things called, or there's a symptom called non-acid reflux, where the patient doesn't actually feel the symptoms of reflux anymore because you've taken away the burning with the meds, but the reflux can still be happening because of the loss of patency from the lower esophageal sphincter. So medications may make people feel better, but I've read some studies that I have referenced in the back that says up to 60% of people that take these drugs and do feel better actually still have non-acid reflux. You've taken care of the acid, but you haven't taken care of the cause of why it happens. So why it happens is the first 3 bullets here: fatty foods, gluten, food allergies, food sensitivities, grain starches. I limp into all one thing: food allergies, intolerances, sensitivities. If you're eating foods that are irritating your gut, and this is different from each and every person, you're going to create imbalances in the amount of acid that's being released and the feelings of fullness or regurgitation of that food. The thing about all of these foods is they're different for everybody. And it's very easy when somebody has a severe food allergy. You can basically ask the patient, hey, what foods bother you? And they might just say, well, pizza, or coffee, or acid foods like tomatoes. And those are easy catches, and you can tell them to avoid it. But when you're dealing with food sensitivities, it could be something that they're eating on a regular basis. Let's just say broccoli, just to get off the gluten thing, which we've all heard a lot of. It could be something like broccoli that they have a food sensitivity to, which means their immune system is reacting every single time they take it in, but it's not an IgE allergic reaction. It's more like an IgG, or a subtle food sensitivity, where the immune system is activated and it's causing problems, but those problems might not occur for 1 to 2 days after the food is ingested. So what does that mean? That people very often, to me, when they're complaining about foods that trigger their reflux, very often say, well, I can have it sometimes and I can't have it other times. But what they might be confusing is something that they ate yesterday, like that piece of broccoli, that's having a delayed reaction. And when they have their, let's say, donut, hopefully they're not having a donut, but when they have their food that they sometimes are sensitive to, it's actually because the food that they're eating all the time is actually just 24-hour delay affecting them. I hope I didn't confuse anybody with that one. But basically, the foods that people eat are gonna drum up these symptoms. And then also eating habits. So here's where I get into a little bit more recommendations for treatment. So we've all heard that we should be eating small, frequent meals. That is one of the greatest things for somebody that deals with reflux on the regular basis. Very less people are recommending food combining. If you haven't heard of food combining, it means that proteins, especially from animal proteins, need a lot of acid to get digested. And so if you eat a piece of chicken or a steak and you have that as your mono meal, and it's the only thing that's in your stomach, the stomach acid should be able to break that down. What food combining principles state that is if you also put a potato or bread or some other starch along with that acid needing protein, that starch is going to soak up the protein and prevent it from being digested properly. What happens is that food can then ferment and it can cause reflux. Late large meals are something that a lot of people also eat. A lot of people are stress eaters. And at the end of a long, hard day of work, they go home and have a gigantic meal and wind up going to bed. And these are simple things that you can tell people to do is just slow down, eat 5 small meals a day, 6 small meals a day, and try food combining. And food combining principles are simple. If they're going to have a protein from an animal source, all they have to do is combine it with a non-starchy vegetable. If they're going to have a starch, like a potato or a pasta, then combine it with a non-starchy vegetable. Now, starches and starches go together, so let me give you an example. Pasta with any type of vegetable would be great. But as soon as you put a big lump of cheese on that, or you have that chicken along with the pasta, it creates a difficult digestive combination. And that steak, it may be fine for people, but if you have that steak with mashed potatoes, it's going to be something that makes digestion more difficult, especially if you have low stomach acid, which we're going to get to in a second. So if you can teach your patients, how to combine their foods properly, they're probably going to have a lot less problems. And the first thing we want to do with reflux is just get them more comfortable. So you can also, when we're trying to understand chemical stress, we need to understand that a vast majority of acid reflux really is non-acid reflux. Well, I should say reflux or gastroesophageal reflux disease is reflux without the acid. So let me give you the story of that. Because of vitamin insufficiencies like zinc and B12 and or B12, you may not actually be producing enough hydrochloric acid in your gut. All right, if you're not producing enough hydrochloric acid and you put that big meal in, the body has to then find a way to drum up more acid to digest that food. Because you don't have enough acid on a regular basis, the lower esophageal sphincter, the thing that separates your esophagus and your stomach, is actually weakened because what it needs is acid constantly stimulating it to keep it contracting properly. So if that lower esophageal sphincter is constantly stimulated by mild amounts of stomach acid, it's going to stay patent and closed most of the time. It's going to be a one-way valve that allows food in and not to back up. But if you're deficient in certain nutrients like zinc and B12, which create the acid in the first place, what will happen is that sphincter will become weakened. And in that weakened state, when you put in food and the acid has to drum up, that acid can escape. So these chemical stresses like nutrient deficiencies, improper eating habits, eating the wrong foods can all cause problems that lead to acid reflux. Dysbiosis and H. pylori, no, there's not going to be a lot of friendly bugs that live directly in the stomach, but if you have SIBO, which is small intestine bacterial overgrowth, you can have gas and bloating that comes actually from the small intestine backing up and causing gas into the stomach, which will lead into acid reflux also. There's a couple other things you want to look at that most people don't realize for those stubborn cases. The autoimmune acid reflux, which could be intrinsic factor blocking antibodies or parietal cell antibodies. A lot of people that I've spoken to, a lot of doctors, don't actually realize that there are antibodies that you can make to yourself in your stomach that will prevent the acid from being formed in the first place. And if you have these autoimmune condition that's preventing the acid from being produced in the first place, you're not going to be able to break down your food, and it's going to lead to more problems of this non-acid reflux, where the food is just sitting there, the lower esophageal sphincter becomes weak, and it can come back up on you. All right, that is what I want to touch upon with chemical stresses. Next is the physical stress. Being a chiropractor, of course, I'm going to talk about physical stress, and the lower esophageal sphincter physically, if it's weak, needs to be stimulated. And what I really want to just talk about is upper cross syndrome. Upper cross syndrome is what this person in the picture has right now. It's a very common posture syndrome that most of us see in our patients, where it's a forward head posture, a hyperkyphotic thoracic spine, rounded shoulders that are forward. Why do we have this? Well, because of the physical stress of looking at our phone in front of us, positioning ourselves incorrectly in front of the computer, and basically looking forward and down all day long, and we've probably been doing that for years. How does posture affect acid reflux? I like to basically say this story, which is the TMJ, cervical spine, diaphragm, psoas pattern. And this is something I see in my office, probably 20, 30% of everybody that I see that has this upper cross pattern has this. And it's something that a lot of people miss with chronic acid reflux that's not getting better from the usual things that usually are successes and 80%ers with you. So here's the first thing. TMJ, or temporomandibular disease, TMD, or dysfunction, is extremely common for people with stress. When you're emotionally stressed, you grind your teeth, you clench your jaw, you create problems. So what happens is these people create, even though it's an emotional trigger, a mechanical problem in the jaw. The jaw, neurologically, is one of the most important parts of your entire body. If your jaw isn't functioning properly, you can't eat, you die. So what does the body's innate intelligence do? Well, it compensates for that jaw problem because it doesn't want the patient to know about it by tweaking the muscles around the neck area. It will basically tighten up certain muscles in the neck to keep the jaw in alignment. And so what the person suffers with is chronic neck pain or stiffness. The third, fourth, and fifth cervical bones, which are very often compensating for this jaw problem, and they can subluxate, which is misalign and irritate the nerves. Those third, fourth, and fifth cervical bones innervate your diaphragm. And the diaphragm is the physical connection to hiatal hernias or sliding hiatal hernias and acid reflux. So let's trace this back again. This person has a lot of emotional stress. They grind their teeth. They're clenching their jaw very often. You'll see this in at least a third of the patients that you deal with. They create tension in their neck, which causes stress to the nervous system in the middle cervical bones, which innervate the diaphragm. And so you'll have actually a diaphragm malfunction, not only because of this kyphotic posture, but because of the subluxations or stresses in their neck. And what happens is if the diaphragm creates a weakness pattern, it'll cause the stomach to be able to slide up and herniate through. Not always. Sometimes it's a sliding hiatal hernia. You can actually get a fixed hiatal hernia where the stomach is actually poking up through. And there are a lot of physical practitioners out there that have probably done this move where you can actually release the stress from the stomach by literally like pulling down on the stomach and pulling it down. If anybody out there isn't a chiropractor and doesn't know this move, I'm sure you can contact your chiropractic friends and they can show you how to do it. But what I do as a practitioner is, besides pulling down the stomach to release pressure there, is actually physically working on the trigger points that form all along the diaphragm. If you touch this, and anybody that has reflux, so far I haven't found a person without it. If you just palpate along the lower ribs, right along the stomach on both sides, you'll find 1 or 2, 3, maybe 4 knots. And I have had every single patient gather a lot of relief just from physically working on those. Now, if you're not a physical practitioner, you can refer to one, whether it's an acupuncturist or physical therapist or chiropractor, or you can instruct the patient, which I do often for homework, to feel along the bottom of their ribs and feel for those little sore spots and rub them and just massage them for 20 to 30 seconds at a time. Just releasing that pressure from there often releases stress from that sliding or full hiatal hernia. So that's how the emotional stress causes a physical stress in the jaw, leads to neck problems, leads to physical problems in the diaphragm, and that can affect sliding hiatal hernia, which causes the lower esophageal sphincter, which separates the esophagus and the stomach, to be less functional and allow food to pass back up through it. Of course, another physical thing is a thoracic kyphosis. If you're physically hunched forward, that actually pushes the stomach up into the diaphragm more fully. Just like central obesity will do that from the bottom. If you have a patient that has a big, gigantic belly, that stomach area is going to be pushed up into the diaphragm and cause some of that. This is the greatest cause of non-acid reflux, the feeling that that person has when they're completely full even though they barely ate. Okay, the pec major clavicular is just an AK thing. It's something that's used in applied kinesiology. The pec major clavicular are the pec muscles that run along the clavicle, and they have an organ relationship to the stomach. So basically, I use those in muscle testing to determine if the correction that I did was finished or not. So let's move on from physical stress into some other things that you can do right away to help your patients tomorrow. And there are two amazing products from QOL. One is Pepticade, which is a combination of artichoke leaf, gut guard, and ginger. The gut guard is zinc carnosine. I have been using zinc carnosine in my practice as my, I don't say even 80, 90% fix for people with acid reflux for many years now. I've just switched to using Pepticade as my source of it because I like that they also tack on the artichoke leaf with this, which is soothing and healing for the gut, and the ginger, which is also soothing and healing for the gut. By the way, the reason I'm switching to Pepticade or QOL from the other company I'm using is because I really like the philosophy that QOL uses. They design their supplements based upon research. So they find the research that has been proven to be effective in clinical settings for these cases, and they design the exact doses, which I have on the next page, to give you an easy to use protocol for fixing your patients. So basically, these are in the exact formulations of 3 or 4 studies which they have on their website, and you can reference that. Some of them were mouse and animal studies at first, but they have a lot of human clinical studies that this was taken from, and the exact doses. And so all you have to do with patients to get an 80 to 90% effective treatment for the initial stages of acid reflux is 1 veggie cap 3 times a day. It's as easy as that. Of course, you can't use this only. You'll want to combine that with a probiotic, and Bifleon is a probiotic that is Bifidobacterium longum. It's a great probiotic for also not only just restoring good, friendly bacteria to the gut, but to normalize peristaltic movement. Whether the person, besides the reflux, also has diarrhea or constipation, what this does is it tends to work on both ends. Bloating, abdominal discomfort. Bifidobacterium longum is a fantastic tool that you can use. Even though I do stress that you should change probiotics from bottle to bottle, from patient to patient, you find out what they need. A great protocol would be to just use these 2 products together. The Bifleon would be taken 1 veggie cap 2 times a day, or 2 veggie caps once a day with a meal. I like it in the morning. And what it gives you is a 10 billion CFU dosage, which is a really effective dosage. These 2 together you're gonna knock it out of the park and help so many people. So what are the other treatment options? Well, if you're dealing with the fact that you have to deal with physical, chemical, and emotional stressors, and you have to address all of those with your patients. If you don't do all those things on your own, find another practitioner that you can work with. I love referring to other people. I don't think I can fix everything on my own. Sure, a lot of people get better. I know you docs out there are great. And if you're on this line, you've been treating people with reflux for years. But every once in a while, you get those difficult cases, and there's always another practitioner out there that can really help you. With the diet, I've mentioned food combining. You can look up some other stuff on that, or you can always contact my office. And one of the other things I mentioned here is AI Paleo. That is my ultimate diet to find out how patients are, or basically to find out the relationship with food and your patients. What AI Paleo is a highly restrictive form of the paleo diet, where not only are you taking out the grains and the beans, but you're also taking out nuts and seeds and nightshades. So it's an extremely restrictive diet, but what I find is if you can get patients to follow that for 3 or 4 weeks, the AI Paleo program is really easy to find on the internet. A lot of times that takes care of a lot of their reflux symptoms. And you can narrow down what foods are affecting them because they have to reintroduce those foods after. This is not a forever program. Of course, if you can't get them to do something like AI Paleo, which is a really restrictive program, many patients feel better gluten-free or at least yeast-free. And as far as stress management goes, I tell every single patient that they need to meditate. Sure, they might need therapy, and for all of you mental health practitioners out there, I really hope you're doing great work with people with reflux. I know I send out for people all the time. Exercise is part of stress management. And again, a chronic reflux patient that's not exercising in some way, shape, or form is going to be one that's more difficult to get better. The supplements we just mentioned, the medications we all pretty much know about. There's that little purple pill. The one thing I really wanted to mention before we close up about the medication is the risks of staying on that medication long term. There are nutritional deficiencies from taking away the acid. Even though you put a patient on PPI and they feel better, again, because you've taken away that acid, that irritation, what can happen is they now have a more difficult time breaking down proteins and absorbing certain nutrients like minerals, okay, calcium, magnesium, and the other trace minerals. So what happens is, even though they're feeling better, if they're on these medications for more than 6 to 8 weeks, if they're on it for really long times, and I'm sure we've all had patients that have been on it for 20 years or more, those patients are becoming nutrient deficient in other ways. So you're robbing from one you're stealing from one to fix the other. Sorry, I got tongue-tied there. What a 4R program is a full digestive overhaul. What the 4R stand for is remove. What you're doing is removing pathogens from the body, because that could also be a cause, whether it's H. pylori or some other microbe. You want to give the patient something to knock down or kill off the pathogens, whether it's a drug or an herb is up to you. The re-inoculating the gut with the good probiotics, restoring digestive enzymes, because remember that just because you give them the probiotic, you've calmed down the gut, it doesn't mean that they can actually digest. So digestive enzymes are a really good tool in the meantime while the person rebuilds their ability to digest on their own. And the fourth R, the repair, is the most common thing I use is L-glutamine. The only thing I didn't mention in the chemistry section of something that I use on virtually every patient, the dosage I use is anywhere from 3 to 5 grams of L-glutamine per day to start with. And I've seen fantastic reactions on decreasing inflammation from that and having people feel better as a side effect. It's also great for building muscle. And then, of course, sometimes you're going to have traditional medication. Sometimes you're going to need that 6 to 8 weeks of that proton pump inhibitor because the person's been suffering for so long, okay? But basically, what I wanted to do is give you a page of references and let you know that if you want to reach me for any reason, my website's down there. There's tons more information from QOL Labs. I hope I didn't speak too fast and run through too much in too much short of a period of time. I was trying to squeeze in as much as I know within 30 minutes because I'd like to, cram information together and deal with questions after. So, Max, do you have anybody that had any questions?
Sure, yes. Thanks, Dr. Piken. We're now going to begin answering the questions that were submitted. And I have a couple here. The first one was, how long does it take until you see results with patients? Which is a very interesting question. I'm sure you have some good answers for that one.
Sure. And the answer for that is it really depends. I've seen people do the protocol with the Bifleon and the Pepticade and get better in days. And literally they're hugging me just because we gave them the right nutrients. And that's usually the younger people or people that really have never had an acid reflux bout before. They're usually in their 20s or maybe even younger these days. After that, I've also had the patient that has been my toughest patient, had been on PPIs for 20 years, but still had reflux, still had the symptoms. And that one took 6 months. So it really does depend on the person themselves. And basically you wanna give it a few days. On the best case scenario, my average person, I would say 4 to 6 weeks.
Great. My other question that came in was, do you have patients discontinue PPIs first before using the supplements?
Do I have patients discontinue their PPIs first? I am a chiropractor, so as just far as scope of practice, I don't recommend directly that they go off any meds. I always tell them to go back to their prescribing physician and tell them what they want to do, but you don't need to go off those meds first. You can start off these supplements and have the patient go back to their doctor and ask them. If the patient was taking things over the counter, which a lot of these PPIs are available now, you can tell them that basically it's up to them. And they can take in the supplements and see how they feel and try to wean off of them. And I usually have a weaning off process that they go through that lasts 1 to 2 weeks. And most people do pretty well with that as long as you're replacing it with the lifestyle changes that we mentioned and the supplements from QOL.
Thank you so much, Dr. Piken, and thank you everyone for attending today's webinar. You'll also be receiving a follow-up email with a link to view Dr. Piken's recording, which includes the YouTube video and the presentation link with the slides. And also that includes the product recommendations for those interested in learning more about the products he recommended. And on behalf of QOL Labs and our presenter, Dr. Piken today, I want to say thank you for joining us and have a great day.